Hi, everyone, and welcome to our first Community Engagement Series event of 2024. My name is Priscilla Medeiros. I'm the Knowledge Mobilization and Community Engagement Specialist at the Edwin S. H. Leong Center for Healthy Children, as well as your moderator for today's session. I am very excited to introduce our speakers for today. We're joined by Dr. Tanya Sharpe, who's a community engaged researcher. She's incredibly passionate and committed to the development of culturally responsive approaches and sustainable opportunities, allowing Black communities to thrive in the face of homicide violence. Dr. Sharpe is an associate professor, as well as an endowed chair in social work in the global community, as well as the founder and director of the Center for Research and Innovation for Black Survivors of Homicide Victims, also known as the CRIB, at the Faculty of Social Work at the University of Toronto. We're also joined by Mr. DeShawn Hibbert, who's a father of 3 children and has ambitions of working in the community as a social worker. He joined the CRIB in 2022 and is currently the coordinator for the Neighborhood Ambassador Program, which is a program that employs community members who live and work in neighborhoods disproportionately impacted by homicide for the purpose of co-developing culturally responsive approaches to research, policy, and practice. DeShawn is also a coach and youth outreach worker at Thrive, which is a hospital-based violence intervention program funded by the CIHR Insight Connection grant and led by Unity Health Toronto at St. Mike's Hospital. So welcome to both of our speakers. I'm now going to pass it off to them to start the presentation.
Thank you so much for that kind introduction, Priscilla. And it's always a delight to present to the Edwin S.H. Leong Center for Healthy Children with my colleague, DeShawn. So thank you all as well for taking time out of your day to be here. I wanted to share with you a story that for those of you who have heard me speak, have heard me tell this story many, many, many times. And every time, and DeShawn will tell you this, and many of my colleagues on the line will tell you this, every time I'm asked to present, whether it's a keynote address, a panel, I have a bit of trepidation. Should I tell the story? Should I tell the story again, even though I know people in the audience may have heard it before? And every time I have this exploratory conflict, I come up with the answer, and the answer is always yes. And this answer is always yes for 2 reasons. One, I want to make sure that you don't forget about the importance of this work and what drew many of us at the CRIB to this work. And the second reason is it grounds me. It ensures that I don't forget. So without further ado, I'll start right there. For the past 20 years, I've been developing a program of research for and in collaboration with Black surviving family members and friends of homicide victims. It's a topic that has real-world implications to spaces and places throughout our global community. Chicago, Illinois, Johannesburg, South Africa, Kingston, Jamaica, Baltimore, Maryland, and of course, right here in various provinces and territories in Canada. In short, no one is immune, but I'll circle back to that in a moment. Before I begin, I think it's important that you understand what drew me to this work, my calling, if you will. Before entering grad school, I was working at the Harvard School of Public Health Division of Public Health Practice, working side by side with family members and friends who were surviving the homicide of a loved one. And it was during that time that I met Edna. And when I met Edna, Edna's son had just been murdered. A bunch of us who worked with Edna attended the funeral to pay our respects. And I remember entering the church, and as I approached Edna, I extended my hand and said, "I'm so sorry for your loss." Edna looked at me with disdain and said, "I didn't lose my son. He was taken from me." Now her words struck me. They struck me to my very core. And it was in that moment, that exact moment, I knew I was called to do this work. In that moment, two things became abundantly clear. If I, as a trained social worker, even with the best of intentions, did not know how to help her, support her, how equipped would other service providers be? The other thing I thought about was how would Edna cope with the murder of her son? Now, Edna's story is not unlike the surviving mom whose son had just been murdered 1 month prior to my meeting her after delivering the keynote address at the inaugural Survivors of Homicide Victims Conference in Toronto. And all I could do is hold the space for her pain. A few years back on a trip to Boston, I saw Edna again, and I ran over to her with excitement. I wanted to tell her that I kept my promise, that through my work, our collective work at the crib, I'm uplifting the voices of so many who feel voiceless. That familiar weight of sadness clouded her eyes, and she grabbed my hand and said, "Tanya, I'm so glad, because my son Leonard, Edna's youngest son, was murdered last year. Time is running out," she said, "and we need you." So I'm very clear that the work that we do is in service to them. The survivors whose wounds are not visible to the naked eye, but in the absence of culturally responsive interventions, are often left to fester and never heal. Now, I want to provide some context relevant to homicide throughout our global community. On average, each year, 17,000 murders occur in the United States. And what you'll hear many people say is that compared to other forms of violent crime, that number's fairly low. However, when you think about who the majority of homicide victims are, young Black men and women living in urban areas, and when you realize that although Black people make up only roughly 14% of the United States population, and yet they account for more than half of the homicide victims, when you understand that on average, African Americans experience the homicide of a loved one at least 2 times in their lifetime, you begin to realize that we are dealing with an epidemic that disproportionately impacts some of our most vulnerable communities. Now, this overrepresentation is not unique to the United States. On average, 600 murders occur in Canada each year. And out of the 13 provinces and territories, the numbers of homicides are often highest in Ontario. And in 2019, racialized populations accounted for 75% of homicide victims in Ontario, 44% who identify as African, Caribbean, and Black. If you think about in Jamaica, on average, Jamaicans experience 1,500 murders each year, 9 times the global rate. In South Africa, South Africans experience 18,000 murders each year, 7 times the global rate. And here, just so you can see, from 1992 to 2021, the number of homicides have been consistently highest in the Ontario province. Now, Redmond and Doka and many others suggest that on average, each homicide victim has at least 7 to 10 family members and friends who are struggling to cope with the murders of their loved ones. Now, the numbers alone don't allow for us to see that for Black people, our relationship to one another extends far beyond country borders and blood ties. So the ripple effect and impact of homicide is far-reaching, suggesting that the number of family members and friends may be far greater than research predicts. In addition, when we consider the frequency in which homicide occurs in Black communities throughout the global diaspora, United States, Canada, the Caribbean, Africa, Brazil, you begin to understand that we are dealing with a disproportionate number of Black people who are struggling to make sense out of that which is senseless. The numbers alone, devoid of both social and cultural context, it contributes to gaps in research, policy, and practice, often allowing for false narratives to be made about the causes and consequences of experiencing the homicide of a loved one for Black communities. And this chasm, this gap results in mistrust in formal institutions such as university systems, the police, our medical and mental health care systems, the justice system, et cetera, et cetera. Now, I want us to take a moment. I want us to take a moment to really understand the disproportionate reality of homicide for Black people. Specifically, I want you to think about who Black survivors of homicide victims are. They are people you come in contact with every day. Your clients, your child's coach, your students, your mechanic, our military, your colleagues, the pilot that offered a soft landing home from your last vacation, your grocery store clerk, your family members, your children's friends. They are people you come in contact with every day who look just like me. They are your Ednas. They might even be you. So it's with this understanding of who they are and how we are all impacted, we are better positioned to not only understand the prevalence of cumulative Black death, we begin to comprehend the traumatic pandemic of grief that disproportionately devastates Black communities. With this understanding, we are better informed about ways we might support and intervene. Now, you may be thinking, as tragic as homicide is, I can't relate to the Black experience. Or perhaps you're thinking that the subject matter is not related to your area of expertise or your organization's focus. I want us to take a moment to think about that. Really think about that. When we consider the plethora of systems and services that survivors of homicide victims engage with on a daily basis, as well as the ones they need and interact with as a result of experiencing the murder of a loved one, social work, medical and mental public health care systems, educational systems, law, justice, criminology, and socio-legal services, public policy, technology, engineering, data science, faith-based institutions, global affairs, sociology. You begin to understand that you as service providers, policymakers, you play a pivotal role in what should and could be a national response to this under-researched and unacknowledged pandemic of grief for Black communities. What we must also keep in mind is that Black people are not only grieving the pervasive murder of family members and friends on a global scale, but they also experience collective trauma as a result of seeing the constant, brutal erasure of us over social media streams, played over and over and over again. This chronic exposure to cumulative Black death, wherein even if you are not related to the victim, you see yourselves, your sons, your daughters, your sisters and brothers in these images. This collective trauma contributes to the grief of our humanity, our safety at pandemic proportions. And it does something to you. It shatters one's soul. These individual and collective experiences of homicide impact the mental, the physical, and spiritual well-being of Black survivors of homicide victims, leading to a ubiquity of injustice that complicates and disenfranchises their ability to grieve. If by chance a murder is captured on video, we wait. We wait with bated breath for the perpetrators to be brought to trial and convicted, holding out for some shred of acknowledgement and recognition that we have the right to jog while Black, drive while Black, order coffee while Black, talk on a cell phone while Black, enter a dorm room while Black, bird watch while Black, eat ice cream in your own home while Black, breathe while Black. We experience the ubiquity of injustice not only in the collective viewing of our demise or during trials, but we also experience it when the prevalence of Black homicide is not acknowledged due to the lack of race-based data collection, as is the case in Canada only since 2020, when we started to collect race-based data on Black homicides here, or when race-based data on homicide is available. Absent from the discussion is the overrepresentation of Black homicides, particularly as it pertains to Black cisgendered and trans women. When we think about the systematic way anti-Black racism permeates the very fabric of our society, infecting like a relentless virus of violent inequity, those structures that Black people rely upon for their survival, we have a responsibility to take action. As we position ourselves as individuals to be more culturally responsive in our continuity of care for Black survivors of homicide victims, we must understand that the social cultural context in which you and Black survivors of homicide victims are operating in, we must understand that and recognize that it starts with recognizing that race is a powerful organizing principle in our society. There is no behavior that we participate in that is not in some way shaped by race. It is deeply significant, yet we deny that significance. We also have difficulty discussing it, which exacerbates the awkwardness around such discussions. When we think about racial issues as outside of ourselves, it's much harder to have meaningful, progressive conversations. It's a deeper presence when we consider how it acts out in our lives, when we engage in self-reflection and self-integration. Moreover, when we embrace this work with critical reflection, we are better positioned to identify factors that influence our engagement, our community engagement with victims, and understand their engagement with us. Now, we could enhance our awareness by watching a video, reading a book, or letting this time together to be the only time that you engage with this content. But if we do that, if we allow that to happen, we deprive ourselves of sustainable growth and development. But more important, we do a disservice to the people we have promised to serve. To understand the social cultural factors that impact Black survivors of homicide victims, we must do the necessary work of seeing, which asks us to examine how we understand, define, and know why and how Black people are disproportionately impacted by experiencing the murder of the loved one. Being, which is about sitting in a state of critical reflection about the ways we have been complicit and complacent, to the ways we can best position ourselves to support Black survivors of homicide victims. This state of being, it challenges us to spend time, critical time, thinking about who we are and where our biases come from. Only then should we advance to the doing, developing and implementing the community engaged social action, social service and delivery to create culturally responsive change. Now, After meeting Edna, I thought about how I might take action, how I could make a difference for thousands of individuals and communities struggling to survive the unthinkable. So when I started out, I said 20, 25 years, I mean, the gray hair is showing it, but when I started out doing this work, there were significant gaps in post-homicide research. Research on homicide focused primarily on the victim and perpetrator. Absent from the discourse was experiences both on the individual and community level for African and Caribbean and Black folks. Coping strategies were absent from the literature. Examination of mental, physical, and spiritual well-being as a result of experiencing the homicide was not examined. And the patterns of service utilization for Black communities was not being explored, and culturally responsive programs and tools of measurement were not yet developed to best position us to deliver culturally responsive services. So I started my work in the United States and brought that work here with a model of coping that I'll share with you, a tool of measurement, etc. But I started my work in the United States, and I say that because much of what I'm about to show you is centered there. With the following research questions, looking at what is the post-homicide experience of African Americans, what supports do they utilize, what are their grief responses to experiencing the homicide of a loved one, and how do they cope with the homicide of a loved one. So by listening to the voices, just listening to the voices of Black survivors of homicide victims in the United States, I conducted in-depth interviews, which allowed me to hear what they were saying about the influence of who they are, the obstacles that they face, and the impact of those experiences on coping with the homicide of their loved ones. Through this process, I was able to better understand both the social and cultural context that influenced the manner in which African American survivors of homicide victims experience the homicide of a loved one, identify resources to cope with it. Let me show you. Now, Alexander and Ho refer to cultural trauma to describe the experience of being oppressed and marginalized and disenfranchised based upon one's race or ethnic status. And so the following theme identified by African American survivors of homicide victims falls under that domain. Cultural trauma, ancestral survivorship specifically, where Margaret, a surviving grandparent, stated, "I just have confidence in African Americans' ability to be a people and understand from whence we came and understand how much baggage we've been able to destroy or clean up or whatever it is that we've had to deal with that I don't think we were born to bear. I believe the ability of my people to overcome so much and so many things and still have not truly, in my opinion, arrived at first-class recognition by many, many people. We are still, I think, some of the greatest achievers there are." So this messaging about if Black people have survived enslavement, continue to survive oppression, surely we can survive anything else. Anticipated hardship. I'm trying to make sure that you understand that one of the reasons for me, and I dare say the majority of African Americans and people of color, the reason we keep things to ourselves is life is supposed to have a little bit of pain. You know, no sunshine without the rain. We grew up with those kind of anecdotes that make us hold things in. I want you all to keep your eye on Elaine, who's a surviving aunt. But here she's talking about the fact that because of racism, anti-Black racism and oppression and marginalization and being disenfranchised, that we anticipate that this level of trauma and constant conflict is going to happen. So the reason why that is so important to bring up before we even get to talking about homicide is because you have to recognize that Black people are experiencing a pervasive chronic level of trauma as a result of anti-Black racism before we even get to homicide. However, when a homicide occurs, what the survivors were saying is they enter into a culture that is altogether unique. And I named this particular domain the culture of homicide, where shame and stigma, for example, are most paramount. Malik, a surviving cousin, said, I try to cope now by not being ashamed to talk about it because I was ashamed to talk about it, especially being African American and those stereotypes of African Americans that we are just prone to this. And, like every time I tell people this, not every time, I'm exaggerating a bit here, but someone says, oh, is it drug related? Like that is the first thing that pops out of their mouths. So Malik is saying essentially that I am not going to be quick to talk to a clinician, a medical health care provider, my teacher about the fact that I've experienced the homicide of a loved one because they're automatically going to assume it's gang or drug related. This is a constant theme that I hear from Black survivors of homicide victims. Blame. I question whether or not there was something I could have done to keep him out of the environment, and therefore perhaps this never would have occurred. So I guess I'm saying in some sense, I'm always questioning whether or not I'm partially or a bit somehow responsible for his tragic death. This is Elaine, a surviving aunt, who every summer her nephew would come to spend time with them. And the one summer he didn't was the summer he was shot and killed. Again, this is a chronic theme that I hear from Black survivors of homicide victims if they didn't walk their son or daughter to school, and that was the day that their lives were snuffed out. Lack of justice. I remember my brother was like, we all know who did it. And the problem is the police aren't doing anything about it. My brother was like, I know who it is. We all know who it is, because my cousin was apparently not the right target. It is unsolved, and we just feel like they, meaning the police, don't care. This is again Malik, a surviving cousin. This theme comes out a lot when we work with Black survivors of homicide victims. And it often, it is talked about in the context of if, for example, a 911 call is made and the time that it takes for police or EMTs to arrive to the scene is very long, or if the murder is unsolved and there's not a follow-up by law enforcement, there is a sense of lack of justice, that their loved one's life does not matter. So now we think about cultural trauma and we think about culture of homicide. And the work of Lazarus and Folkman, who have done a lot of work on stress and coping theory, helped to explain some of what was happening here. A stressor, homicide occurs, and survivors appraise that stress to determine what coping strategies will be utilized to manage that stressor. And yet for African-American survivors of homicide victims, it didn't appear to be that simple. And so the work of my colleague and friend, Dr. Sean McGuffey, who's a sociologist, came up with this construct called racial appraisal, which basically states that for Black people, disenfranchised populations, racial appraisal consists of both culture and structure. Culture is a set of shared attitudes and beliefs about the way things should be done, and it is crucial to how people perceive and cope with trauma. Structure shapes those perceptions in that it dictates the distribution of resources, medical, mental health services, legal, sociocultural services. Race is a component of our social structure that allocates material goods and services throughout our country, but it does so unevenly based upon race. So racialized populations like African Americans appraise stressful encounters and assess coping resources based upon this paradigm. So what are the implications for coping then? Survivors came up with, that I interviewed, talked about spiritual coping. My grandmother used to say, if you have a problem, take it to God. She didn't say take it to the therapist. I believe in God, but to a certain extent, because I don't think God takes an innocent baby or a person that good that wants to help the world. So I keep telling myself he probably needs another angel now. So spiritual coping here is utilized to make sense of the tragedy, but also really saying that and indicating to us what are the first sources that individuals go to cope with their traumatic grief. Maintaining a connection to the deceased, I try to cope with it by maintaining a personal connection with him, meaning like having conversations with him sometimes when things get difficult, or remembering now that I don't want anybody else to have to deal with me with the kind of thing that I did. So almost talking to him or praying to him to get through not only the grief that I feel regarding his loss, but also to get through and do the work that I need to do. This is Trinity, a social worker who was surviving the murder of her cousin and was really, really reflecting upon her own experience with surviving the homicide of a loved one. But how will she be able to position herself to help other individuals that would experience the very same thing? Collective coping and caring, I really focused on what my family was going through rather than what I was going through. I was really like, what do you need? How do we get to this together? So in many ways, that was my coping mechanism by not dealing with it in many respects. So I focused my energies on helping other people. This is Malik, a surviving cousin, and a very common theme. It is well documented in Black family therapy, stress and coping theory with Black families, that they often rely upon informal supports, family supports, friends supports for any type of stress. What I want to uplift into this conversation with you today is that for homicide survivors, it is not the whole collective family unit that is helping that entire family cope with such traumatic injury. It is typically one or two individuals that have the fiscal resources to fly aunts and uncles to the funeral service, to, if the primary caregiver was the person that was murdered, to care for the family in the aftermath of homicide. I invite into the space then, where do they go for support? How are they coping if they are holding the weight of the entire family that has experienced such tragedy? And I want to also invite into the space the first few slides that talked about the pervasive and chronic exposure to cumulative Black death. In fact, our preliminary data is talking about, for African, Caribbean, and Black families here in the GTA, they experience the homicide of a loved one, not once, not twice, but at least 3 times in their lifetime as a result of experiencing homicides right here where they live in Ontario or in Toronto, in their home country, and to family members in the United States. Concealment. I think I tend to internalize and find a small part of my heart or a small part of my mind, an actual small closet in my heart or small closet in my mind to shut off those things that bother me. I don't know if you remember the movie The Godfather. There's a line in The Godfather where Michael says to his younger brother, you never speak against family. You never disagree with the family. You never go outside of the family. And I think that is a kind of my mantra. I am just not of the belief that you go outside of the home to garner assistance with family or personal problems. Now, I told you I wanted you to keep your eyes and ears on Elaine. Elaine is a surviving aunt that I interviewed who has smoked about a pack and a half of cigarettes a day, was diagnosed with high blood pressure and diabetes. I mention that because we have yet, we're actually working on a project right now where we're examining the implications for medical health outcomes with Black survivors of homicide victims, to see what's happening here. We've advanced in terms of examining mental health outcomes, but we really need to keep our eye on the medical health impact of experiencing such traumatic injury. So as a result of this inquiry at the early stages of my career, the gift that survivors gave to me was really being able to create a conceptual model that helped to develop interventions, that also helped to basically to establish the CRIB, the Center for Research and Innovation for Black Survivors and Homicide Victims. And what survivors were saying is that when they wake up, when they start their day on a daily basis, they experience cultural trauma as a result of anti-Black racism. And the themes that come underneath that allow them to cope and carry on are ancestral survivorship and anticipated hardship. And then a homicide happens. And then they enter into a culture that's altogether unique, where shame, blame, stigma, and a lack of justice is most paramount. They fit cultural trauma and culture of homicide are working collaboratively. There's an integration between these two constructs, wherein Black survivors of homicide victims don't simply appraise a stressor of homicide, they racially appraise it to determine, is this resource going to hurt me or help me? Is it going to further harm me, stigmatize me, um, prevent me from getting access? All of these things are playing a role in how they go about identifying coping strategies and how they go about utilizing them. So what are the implications here? And this is not an exhaustive list, but what are the implications for research policy and practice? Really, through this work and the conceptual model that was developed and the tool of measurement that I later developed, it really talked about the fact that research has to be conducted in collaboration with community. We have to do more community engaged work. And what does that and should that look like is what we're going to talk about in the next portion of this our time together. It's important to create culturally responsive tools and culturally appropriate tools of measurement to assess the role of various traumas as a result of racism and their interaction with homicide, violence, and victimization. It's important that we explore the experiences of Black survivors throughout the diaspora. Black people are not a monolith, so we can't simply say what works for one community works for another. Expand scholarship in post-homicide research, engaging with emerging scholars. So we have to invest in are coming up and making sure that we're training them with this particular paradigm so that they are being culturally responsive in their continuity of research, policy, and care. How are we positioning ourselves to share the results with community of the research and also helping community-based agencies utilize this research to position themselves to also continue the amazing work that they're already doing? We need to continue to collect homicide data by race. We need to capture the trauma histories of individuals when we think particularly about the frequency in which Black communities experience homicide. So we need to be collecting the trauma histories of individuals, families, and communities, building community capacity to advocate for policy change. How are we utilizing research to basically inform policy that ultimately informs our delivery of service? Program interventions must be culturally aware and responsive. So we must position ourselves to use models like these so that we know that when we are engaging with Edna, we're not saying, "I'm so sorry for your loss." Lesson learned. How are we training clinical and other professional survivors? And so as a result of this work, we at the Crib developed a post-homicide training certificate program, which we have already implemented with the Parole Board of Canada. And so our intention is to continue to educate medical and mental health care providers, educators, law enforcement on ways they can position themselves to be more culturally responsive in their continuity of care, and creating sustainable opportunities for communities to not simply survive trauma, but to thrive after that. And that's a great segue into the next couple of slides that we're going to talk about relevant to the Neighborhood Ambassadors program. But before we go there, I want to just invite into the space so that you understand that by positioning the voices of Black survivors of homicide victims, I established the Center for Research and Innovation for Black survivors of homicide victims. Again, so that we can respond to the formative rifts through the advancement of culturally responsive research, policy, and practice. We have our vision and our mission. Our values are equity from the community, with the community, embrace and drive change, cultural humility, passion, and determination. And so if you just sort of even looked at our mission and vision and our values, they are rooted in issues that acknowledge and celebrate the wonderful expertise and resolve and resonance that our communities have, and are focused on uplifting that, helping to support and sustain that. I would be remiss if I didn't give a shout out to the incredible team that, really brings this passion and determination to all the work that we do. The Crib is home to over 60 faculty affiliates and community affiliates across 3 campuses of U of T, university systems throughout Canada and the US, who see themselves in the work. They are public health practitioners, they are sociologists, they are medical healthcare professionals who see themselves in the work that we do. And it's necessary to work this way if we understand the magnitude of what's happening to Black communities and how we can position ourselves to intervene. We also have several community affiliates, both in Canada and in the US. who again, we partner with for the purpose of engaging in community-based research. Some of our research projects that through these collaborations have been allowed to manifest our homicide tracker. In the absence of the collection of data by race for Black communities, we said, okay, we're just going to do it. We're just going to look at police data. We're going to look at neighborhood data, and we're going to come up with a tracker that at least at the very least tracks the number of homicides that happen in the GTA, but also takes it a step further and looks at the grief and bereavement services and their proximity to those neighborhoods. And for those of you out there who can probably guess, there's a huge disproportionate access for communities to access grief and bereavement services. So even just the visual depiction of that, we're allowed to sort of make recommendations for policy and services. Our Invisible Wounds project, which is funded by SHIRK, which was designed to uplift the voices of African, Caribbean, and Black survivors of homicide victims in the GTA, understand their experiences, and then create those experiences, have them create those experiences to develop a digital, go through digital storytelling project, which resulted in a short film called Invisible Wounds. Shameless plug, we'll be featuring that film on February 28th, so check out our website for details. But that was a powerful project that really helped us, again, to create a conceptual model that was culturally relevant to the experience of Black people here in Toronto. The Survivors of Homicide Victims and Mental Health Project, a collaborative project with the Canadian Mental Health Association, where we interviewed Black survivors of homicide victims, Indigenous survivors of homicide victims, and their service providers to understand what's hurtful and helpful. How can we create better service delivery that's more culturally responsive? And out of that project, we were able to develop policy briefs. Tracking Injustice Project, which is a project in collaboration with Carleton University. It's the first database of its kind in Canada designed to track police-involved deaths. The Inventory of Stress and Coping for African American Survivors of Homicide Victims, which is that model. I developed a tool of measurement that service providers can use that is both capturing the experiences of cultural trauma and the culture of homicide to better position ourselves to understand how are Black people coping, but how can we amplify those coping strategies in our continuity of care. 3830, which is an Instagram live series where every Wednesday night we hold the space for 30 minutes in collaboration with community partners and feature them on our Instagram live show for the purpose of sharing how they're going about doing community engaged work. An analysis of US police data with my colleague and friend who is now at NYU, where we looked at 4 cities encounters with citizen encounters with police in 4 US cities, and Project Thrive, which is a partnership that the Crib has with Sick Kids, which is really designed to, and DeShawn is actually the community outreach coach for that, wherein we are helping individuals bedside to basically figure out how can we prevent recidivism rates for those who have been injured by gun violence. So those are just a few elements of research that we've been able to conduct in partnership with community agencies, grassroots community agencies, both in Canada and the United States. And so what we know to be true from listening to the voices, that the way to do this work, particularly with some of our most vulnerable populations that continue to be exposed to inexplicable harm, is to do community engaged work. And so I don't want to take DeShawn's thunder because I could continue to talk about it, but I think I'm going to hand it off to my colleague, who's really going to talk to you about the evolution of our community engaged work through one program in particular called the Neighborhood Ambassadors Program, and how he arrived at being the coordinator of that program. So I'm going to hand it off to you, DeShawn. DeShawn?
Thank you, Dr. Sharpe. Hello, everybody. Thank you for coming on. My name is DeShawn Hibbert. Like Dr. Sharpe said, I'm the coordinator for the Neighborhood Ambassador Program. Before we get into that, I'm gonna just give you guys a brief rundown of how I got involved with the Crib. I was originally a participant of the Invisible Wounds Project. Truthfully, when I got whiffed of this research that was going on, I'm be straight up with you guys, I wasn't too like thrilled about joining because of many reasons, right? Coming from where I come from, research, I would say, wasn't really conducted properly all the time, you know? And being from like Jana Wilson, like we're kind of almost scared of research. And then on top of that, you see like such a big conglomerate behind it, like the University of Toronto, you know, like it was intimidating at first. It's like, is this gonna be conducted right? Is this connected with the police? Is like what type of information are they gonna be looking for me? Like I wasn't too thrilled about it, but I was told about it from a mentor of mine. So that gave me the confidence and the trust, you know, like, okay, you know what, let me check this out. And then after going through the program, still at first it was a little shaky. It was during the pandemic. We were doing it all via Zoom. It was a lot of black screens and stuff, not knowing who's in the group with us, just being very vulnerable, you know, to people you don't even know. And like it was an experience, I could say for sure. It was a great experience. It turned out to be a great experience. I'm happy I went through it. I learned a lot. And then eventually one day one morning I was sleeping and I got a crazy call, right? Like in the morning. It was one of the craziest, bestest calls of my life, I would say. I got a call from Dr. Sharpe and she said, DeShawn, I was thinking late last night and I came up with something. Are you ready for this? And I'm like, yeah, what is it? And she's like, what do you think about NAP, the Neighborhood Ambassador Program? And doing this type of work where we're going to have pillars from certain areas of the community that are going to help us conduct research, just like how you weren't too sure about the research when you started the program. We want people like you set up in these communities that could help us spread the proper word and get people involved with the program. And I just as you see me here now, I accepted that with so fast, and this is where it's come to now, you know. So now I'm a part of the crib. I help with so much different things, but main thing as the neighborhood ambassador coordinator, after going through the program, I believe like I have like an understanding now of how to interact with people and how to spread the word. But let me give you guys a brief rundown about the neighborhood ambassador program. The NAP program is a comprehensive training and innovative developed by the crib to developed by the crib designed to level the expertise of individuals living and working in the African, Caribbean, and Black communities. And that is a big thing. Like, for example, I was from one of these communities around Jana Wilson. So I had to come in and just level up my expertise now getting into research now. And then two, we try to create sustainable opportunities to advance the capacity of neighborhood ambassadors to flourish their effective advocates in the community, advocates and community leaders. Sorry. So a part of that is, like Dr. Sharpe talked about it, creating sustainable opportunities. So when you become a neighborhood ambassador, you get so much different training. We get REB training. We go through, for example, with the invisible wounds, we have to do the digital storytelling. You get trained on how to be a digital storyteller. All of these trainings eventually roll over into your next steps of life. You know, after one day when the neighborhood ambassador program or through the crib is not up and running, these opportunities that we gained through training now gives us the opportunity to work in other places and help with other researches, and also the community connections we built through the neighborhood ambassador program with like all the other communities that are neighboring that we do our research in. It helps 100%. And that's how we sustain the opportunities after being a neighborhood ambassador. You have these skills and trainings that you can roll over into other positions moving forward. Also the roles of a neighborhood ambassador. Very sorry about this. To address the needs of ACB survivors and homicide victims, Roles of the neighborhood ambassador is to address the needs of ACB survivors of homicide victims by fostering and collaborating between the CRIB and community-based organizations, service providers, and community members. NAs play an essential role in designing and implementing interventions, including recruiting participants for research projects, collecting and analyzing data, and like things like that are very key to the neighborhood ambassadors. When you're a neighborhood ambassador, for example, we do research in like the Jane and Finch community, we'll have a neighborhood ambassador that is specifically from that community. So they're familiar with the people in the community, they're familiar with the resources the community usually uses. So that is like our entry into that community. And then at the same time, we'll have a neighborhood ambassador from like Regent Park, for example, and they're familiarized with all the community resources. They're familiar with some of the youth in the area. So now when we're going into these areas of research, we have representation, we have credibility. We're just not entering blindly and saying, hey, can we just round up some of you guys' information for this research? We actually coming in with like somebody that is somebody that is reputable in that community. And it helps a long way. It goes such a far way. You know, it's like we call it almost like a line of credit to the communities. So things also, the NAs are trained to co-facilitate. The NAs are trained to co-facilitate focus groups with CRIB research team members, participate in the analysis of data, and contribute to the development of the culturally responsive policies and programs designed to support the ACB communities. So in that aspect, the neighborhood ambassadors, there's like a group of 10 of us. We've contributed heavily to like the mental health protocol. We help design and implement how we're going to go about that. We also help contribute to how we conduct the researches, our strategies on going into the community, our strategies on recruiting, our strategies even on hosting focus groups, like things to look out for, what to notice, what is something strange when you're holding a Zoom meeting with 10 kids and one person's screen keeps going from on to off, or one person is, you noticeably see them with their head down, or things like this. All of these things are things that we factor into our focus group hosting and our focus group training amongst each other. A lot of other things we do weekly meetings just to stay on the same page with all the neighborhood ambassadors. As the neighborhood ambassadors are out recruiting for our programs, we make sure bi-weekly we meet up and just talk about what we've been noticing, like where's the hot spots, what type of strategies did you use that was successful in your recruitment, what type of strategies did you use that weren't successful, what did you notice people were standoff to, or what did you notice was people were very receptive to. So all of those things help us just be more successful and be more efficient in our recruiting and just our implementation of the program.
Thanks so much, DeShawn.
No problem.
He's being very modest in his delivery. You know, truly, the vision came when I was very clear again about if we position the lives and the expertise of community, it allows us to be more successful in our engagement and research. And so that's kind of the aha moment where I woke up. Didn't have funding, but I said, we're going to do this thing. We're going to create the Neighborhood Ambassadors program. And it's really, again, uplifting the expertise of individuals who are already doing the work in various ways, informally and formally, and putting that into a program that allows them to work across community engaged research projects. There are two in particular that I want to uplift into this discussion, and I know we have to end soon for questions, but our first is called RISE Young Black Men Toronto. The RISE program stands for Restore, Intervene, Support, and Educate Young Black Men. It is a community engaged project that is actually done and delivered on virtual space via Instagram. It's not a mental health program, but rather a mental health education program targeting young Black men to understand how grief and loss and bereavement manifest in their daily life and how they might be able to use different services and support of one another and other resources to be able to manage that grief and bereavement in a safe way. This, in my mind, is both a prevention and intervention program, because without acknowledging the disproportionate reality of grief that they've experienced and intervening with some education on how to best protect themselves, we have a situation where we're putting them at greater risk for continuing to be involved in violent incidents. And so neighborhood ambassadors are not only doing the recruitment, pre and post death data collection with focus groups and survey screening, but they are actually implementing and monitoring the engagement with the curriculum that they helped to create through this project. The other, I would be remiss if I didn't mention this, is funded by the Young Center, which is called In the Aftermath, which, just like the Invisible Wounds Project, is targeting younger Black survivors of homicide victims between the ages of 12 and 16 for the purpose of understanding what their experiences are. And this is at the request of community. Community asked us to focus on younger kids who have experienced have experienced homicide, violence, and victimization, and they will also have an opportunity to create a digital story as well. So with our community engaged research and by positioning ourselves and doing this work, what are some key lessons we've learned? Number one, Rome was not built in a day, and neither is your project. It's going to take a while to build, to grow, to, as I say down further, assess and adjust, because the community is constantly shifting. When something happens in our global community, it impacts your ability to deliver a service. When it's a survivor's victim, how people are going to be engaged. So you really have to take the time to be able to be flexible, but also to establish relationships. This is another reason why the neighborhood ambassadors are so critical. They already have the relationships in the community. So they allow the crib to have street cred, so to speak, credibility with different participants, different communities, and different groups as we move through doing community engaged work. Communication is so key. Again, neighborhood ambassadors say that word is not going to work. The way you're presenting this is not going to work. That platform that you're distributing recruitment flyers is not going to work. And so they're very key to positioning us for success, to ensure that our communication is consistent, but also it's coherent and it's culturally appropriate. Reciprocity, you have to be clear with community folks in terms of what do I want and what am I giving? And sometimes that can be in the first 3 months, this is what's going to happen. In the first 6 months, this is going to happen. The reason why this is so important is because community agencies are often working on a shoestring budget to do so very much in a very short period of time. But as researchers, we have to go through an REB process, which takes a long time. We have to go through a certain standard protocol, which takes a long time. If we're not clear with our community partners about that time and why that's being done, we run the risk of fracturing that relationship, because there's urgency, particularly as it pertains to the work that we're doing. Timelines, like I said, be flexible, always be willing to assess and adjust. As DeShawn mentioned, every Wednesday neighborhood ambassadors are meeting to assess and adjust our recruitment strategy, our program delivery, but we also have built into several of our programs different points in time where we have to take a step back and say, how is it going? That's necessary when we're doing this kind of work. Measuring a sustainable impact, how are we measuring our success? And we have to measure it in many ways. Yes, survey data, but also focus group data of your program staff, participants, etc. Compensate people for their time and expertise. Neighborhood ambassadors are paid employees of the crib. And whenever we contract out to other labs, other centers, they have to pay and compensate them as well as paying your participants. Diversify your team. Our neighborhood ambassadors come from so many different neighborhoods, so many different experiences, which I think enriches our ability to move. Cost versus reward. We have to think about, when you create a budget for your project, being very clear with your funders about not only the cost of the project, but where the reward can be that matches onto their strategic planning, right? Really beginning to make that an easy sort of clear reward, if you will. Mobilize knowledge. How are we sharing the information? Neighborhood Ambassador has been very clear. Yes, we have to publish. Yes, we have to do presentations, but how are we also sharing this work with the community? They've asked us over and over again, for example, to feature our invisible wounds, which is findings from our research, 30/80/30 Instagram. So we have to think about innovative ways to make our findings accessible to community, and then celebrate success along the way. DeShawn is masterful at this. Every Wednesday, he's celebrating the fact that we got 2 people recruited. He's celebrating. So sometimes when I'm just like, oh my gosh, we only have 6 people, he's like, but Dr. Sharpe, we got 2 people from this area. So you always have to celebrate those successes along the way to make sure that you're be able to sustain the momentum. Stopping. Thank you. Questions.
Thank you so much, Dr. Sharpe and DeShawn, for coming today and speaking about all the incredible work that you're doing at the crib. We are a little past 1 o'clock now. So if there are questions for Dr. Sharpe or DeShawn, I'm sure they would be happy to answer them via email or through their other modalities of contacting the crib directly. But again, thank you to our speakers for joining us today. And thank you to those who also joined on the call for our community engagement series. I wish you all a wonderful rest of the day and certainly look forward to seeing you at our next community engagement series. Bye now.
Thank you.
Bye.
Thank you so much.